Yes.
So did we lose Harry?
Possibly. No, he's still there.
Okay. All right, is everybody ready?
Ready?
Yes.
Yes.
Sure.
All right, Madam Vice Chair.
Everyone will bow their heads. Dear Lord, thank you for allowing us to come in here, tonight, even though it's virtually through Zoom. Please keep everyone safe. Make us have good decisions on behalf of our county, and please guide us in doing so. In your name we pray. Amen.
Amen.
Yeah. Ask Court to put up the American flag and ask prepared to stand. Right. I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Be seated. First item on our agenda is the consent agenda. What is your pleasure?
Move to approve.
Mr. Schreiber moves to approve. And who seconds? Who makes that? Mr. Speed made the second. All right.
Mr. Dunston,
Yes,
I apologize. Who made the motion?
Mr. Shriver, Michael Shriver.
Thank you.
And Mr. Speed seconded.
Thank you.
We'll now do a roll call vote. Mr. Bunn,
Yes.
Mr. Shriver,
Yes.
Mr. Jones,
Yes.
Mr. Ford,
Yes.
Madam Vice Chair,
Yes.
Mr. Speed.
Yes.
All yeas and no nays. It is so ordered. Item 2 on our agenda is comments from the public. This is a time to set aside by the Board of Commissioners to allow individuals to address the board on issues concerning the county. As you know, since we've been in the virtual meetings, the members of the public would need to call before noon today and present their comments. And I believe we have one person who has signed up for public comments, and we're going to ask David Hardister if he would up now and give his name and his address and make his public comments.
Mr. Dunston, I don't see him on yet.
You don't see him on yet?
No, sir.
Okay.
He may have had his issue resolved by Kristen answering his question. I'm not sure.
Okay. Okay. Well, since we don't have any others, then.
Mr. Dunston,
Yes.
on the list that I got from Kristen, I have 4 other people signed up.
Oh, you do?
Yes,
Okay.
sir.
I didn't get that list then. Let me know who you have.
I have Frank Winstead,
Okay.
That's right.
All right. I didn't get that list.
I apologize.
Okay. Mr. Winstead, please state your
Hello.
name, your address.
Hello, this is Frank Winstead, 145 Victoria Court, Youngsville, North Carolina, 27596-7739-45. Good evening, all. How well does the Franklin County Health Department manage people's data? Franklin County Health Department has made public some info about 2 Franklin County congregate living facilities, each with a COVID-19 outbreak. The health department uses these 2 outbreaks as justification for much of their activities and spending. Here is some publicly available info that the health department has not shared. The 2 outbreaks are in buildings next door to each other. Check Google Maps. They even have a private shrub-lined sidewalk connecting the 2 facilities. Check Google satellite images. And a check of state-registered business names shows that the major officers of both companies are the exact same people. I guess the health department overlooked that. Even though there are officially 2 completely different outbreaks at 2 completely different locations, some people might think there is only really 1 outbreak, considering how the 2 facilities are designed with such easy access and run by the same people. Let us hope the health department does better data processing with their contact tracing and COVID-19 test sample collections. This is fairly complicated stuff. Back in 2011, public health officials in Pakistan during a vaccination drive happened to acquire DNA which belonged to Osama bin Laden's children, and through U.S. data processing efforts, bin Laden was promptly located. So the complexities of public health data processing should not be underestimated, but no 100% law-abiding citizen should have anything to worry about from the Franklin County Health Department. People should definitely not worry about giving their personal information to the temporary workers who do the contact tracing. It is just as safe as talking to a census taker. Even though 44% of Franklin County homes have not responded to the census, there is nothing to fear from giving the government your household details, at least not since the 1930s census in Germany. Good night, all. Bye-bye.
All right, who else do you have, Jamie?
The next one I have is Greg Thomas.
Mr. Thomas, if you would state your name, your address, please. Mr. Thomas?
I don't see Greg Thomas.
Okay. The next one I have is Scott Strickland.
Mr. Strickland, if you would state your name and address, please.
Scott Strickland, Nicholas Lane, Lewisburg, North Carolina, 7549.
All right.
I'd like to know where we stand with the open band internet. I've signed up several months ago and still haven't heard anything from them. What I'm needing to know is how much equipment's going to cost. I know how much it's going to cost, but I don't know how much the equipment's going to cost. And that's something that we need to be getting out to the people that's going to use stuff. I'm really disappointed I already got that out, that we need to be getting this stuff to the people so they can prepare to use this service. And then the next item I have, I know we ended our radio testing thing last Monday, and we're still having issues. And I'm hoping we can get this cleared up very soon, because it's very concerning for the safety of our emergency personnel with the radio trouble we're having. The trucks are calling in 5 and 6 times, and nobody's hearing them until 6 or 7 times down the road. And that's all I have at this time, and thank you for all you do.
Thank you, Mr. Strickland. Do we have someone else, Jamie?
Yes, sir. Denise M. I cannot pronounce his last name. Frutiger.
Denise?
Frutiger?
Denise Frutiger?
I don't believe we have her online either.
Has Mr. Hardester come online, Coy?
No, sir.
Okay. Is that the end of the public, of the public comments, Jamie?
That's all the names that I have. Yes, sir.
All right, thank you very much.
Yes,
Then
sir.
we will move to item number 3 on the agenda, the Fleming Forest preliminary assessment roll call. Is Scott here tonight for this?
Yes, I'm bringing him in.
Okay.
Yes, sir.
Mr. Hammerbacher?
Yes, sir. Thank you. In May of 2019, the Board of Commissioners approved a final assessment resolution in order to provide initial funding for the repaving of streets within Fleming Forest subdivision with approximately 82 homes within that development. We've gone through and completed work at a total cost of $229,215. As required per general statutes, we're required to have a public hearing, notifying all residents of the assessment to allow them to speak regarding the potential assessment. We've mailed letters out. This agenda item has been advertised correctly. So right now at this point, I believe it's just before this board to hear any comments you may receive. I've received very few calls, just 2, and basically the sentiment was they were ready to start making payments on their assessment or repaying the county for the work that's been funded. Happy to entertain any questions you may have before we open.
I'm having a hard time hearing some of this. I'm sorry.
I'm sorry, Mr. Foy, basically the purpose of tonight is that it's all, can you hear me now, sir?
You're in and out, in and out.
Okay. Is that any better, sir?
We'll try it and we'll see.
If I'm getting closer, I'm going to be in my screen here. But the purpose of the public hearing is to allow the folks in Fleming Forest to provide any comment they may have. They've received written notice of the assessment amounts that the county has funded to do complete street work repairs in order to have the roads turned over by NCDOT.
All right. Did you hear that, Mr. Foy?
Yes.
All right. Are there any other questions from the board? If there are no other questions from the board, we declare this public hearing open. Any comments? Pro or con? Or does anyone sign up for public comments?
No one signed up. They can raise their hand if they want to make comments at this time.
No hands are raised?
No hands.
All right. If there are no comments, we declare this public hearing closed. Okay. So we need to wait 24 hours, is that right?
Yes, sir. We'll need to wait 24 hours
Okay.
after this, and then we'll need to take a motion to approve the final roll call for the assessment.
Okay, after we waited 24 hours, is that
Yes,
right?
sir. That's correct.
All right, very good. Okay, thank you so much, Mr. Hammerbacher.
Thank you.
Item 4 is an update of our COVID-19. Health Director Scott Levine will provide an update on the pandemic.
Hi, how is everyone this evening? I'm glad to be back. Unfortunately, I wish I had better news again. As of today, and I'm going to turn down my sound because I hear an echo. So if you could just wave if you have questions. As of today, we have 983 new cases. That's actually on the low side. We've had 6 days over the last week, and a little over a week, actually, where we've topped over 1,000. We've seen the highs for daily new cases increase.
Scott,
Our previous high was on May 23rd at 1,107. On Saturday, May 30th, that record was moved to 1,185. On Saturday, June 6th, 2 weeks after entering phase 2 of the reopening, we topped out at 1,370 cases. And last Friday, we had a single day increase of 1,768 new cases. Now, some folks would say that those cases are largely due to increased testing. Again, the percentage of tests that are positive, that percentage number is going up. It rarely goes below 8% now, and it's usually hovering in the 8 to 10% range. So we're testing more people and we're having a higher percentage positive. Also concerning is that the number of hospitalized individuals has increased. We now, as of today, have 797 in the hospital, but on Saturday, the 13th, we hit a high for this pandemic in this state of 823 in the hospital. And on that day, there was only 13% of hospital ICU beds that were available. As of today, 22% of the ICU beds are available. So that's the state numbers. Looking at Franklin County in particular, we are seeing a large increase as well. As of this morning, we have 231 confirmed positive cases. To keep that in perspective, on May 18th, when I reported to this board, the prior 2 weeks, we had 21 more cases than the 2 weeks before. On June 1st, when I reported to you, we had 35 new cases more than the week before, or the 2 weeks before. And as of today, we now have 72 more cases than the 2 weeks before. We are seeing a dramatic increase in community cases, and the number of contact investigations are also picking up. And that's a result of our residents being exposed to positive residents from other counties. And also the fact that we're seeing more multi-family and large gathering exposures with 8 to 12 people on average having contacts with each positive person in Franklin County. On the bright side, the deaths have stopped. We have had no further deaths as a result of COVID-19 in Franklin County residents. So that is very good news. Let's see, I'm just moving into at the statewide and looking at some of the initiatives that are going on right now. All right, I'm just going to skip over all that. For contact tracing workforce, you've heard a lot of talk about the state moving out contact tracers into the community and into health departments. The plan was to deploy 250. Our regional coordinator we met with via Zoom, and that person identified, her name is Phyllis Gray. She was a former health director herself, and informed us that we had our first contact tracer assigned to Franklin County. We met with that person via Zoom on this past Friday, and they started today. And we were also notified that we will have at some point this week a contact tracer assigned to us who is fluent in Spanish. This is really important because we're seeing a large increase in the number of people whose primary language is Spanish coming in for testing and testing positive and needing contact tracers who can speak Spanish. To keep the need for contact tracers in perspective, on average, each person that tests positive has anywhere from 4 to 8 contacts. With those 72 cases that we now have over the last 2 weeks, with anywhere from 5 to 8 residents on average, or 4 to 8 residents who are contacts to those individuals, and the contacts that we receive from out of county, our residents who were exposed to someone who lives in another county, we had to do approximately 200 to 300 contacts to assess risk over the last week. We are definitely swamped. Let's see, I will move forward to the Congregate Care Outreach Program. We now have the results from the last skilled nursing facility, and that needed to be tested in Franklin County. They have tested all their staff and all their residents, and I'm very pleased to report that there is no outbreak status at that facility. That is very good news. We will be moving next to the assisted living facilities and asking that they begin testing all of their residents and their staff. I'm also very pleased to report that on June 5th, the outbreak at the Lewisburg Nursing Center was officially classified as over by the North Carolina Department of Health and Human Services. I sent them a letter dated June 8th documenting that change. The history of that outbreak was 55 residents and 14 staff with lab-confirmed coronavirus case diagnosis, and the virus claimed the lives of 20 residents at that facility. Lewisburg Manor, which is in fact a separate entity, although owned by the same parent company, and yes, very close to each other, But they do not share staff. They were prohibited from sharing staff. So they are in effect separate entities and different levels of care. On June 5th, their outbreak was officially also classified as over. And they did an excellent job. They only had 2 residents and 1 staff member testing positive through the life of their outbreak. So that's some very good news there. In terms of people calling in for information, the number of calls has gone up fairly significantly, primarily from businesses and agencies and individuals wanting more information around opening up businesses in particular and how to frequent them safely. And so we've been answering a lot of calls in that. I can tell you that the last email we received for our coronavirus at Franklin County NC.us was over 3 weeks ago. So the amount of people asking for information from that has pretty much dropped off to nothing. We anticipate that will probably go up as the cases go up and people become concerned again. The last item, 2 more items. One is our drive-through testing for uninsured and underinsured Franklin County residents. On Tuesday, June 2nd, the Franklin County Health Department launched its first weekly drive. And I just have to check here, make sure that's none of you. All right, very good. Drive-through testing operation, and we only had 7 residents who came through that first day. Last Tuesday, we tested 18 people, and tomorrow we are scheduled to test 35 Franklin County residents. So the amount of testing we're doing is dramatically increasing, and I really want to thank my staff for doing a really solid job of increasing that number, really responding and tweaking our process so we can get more people through the line, and doing a phenomenal job. And the last thing I will talk about relates to the really significant increase in cases. With the recent highest daily number of cases, the highest percentage of positive cases of those tested, which is now at 10% routinely, the highest number of people hospitalized, which has been 823, and the exponential growth in Franklin County cases not associated with any kind of outbreak. In order to decrease community transmission of the virus, and that increase that these numbers represent, the health department is strongly recommending the mandatory use of face coverings when inside all public spaces and in all gatherings of individuals who do not normally live within the same home. We will be researching the orders recently adopted in Durham and Orange counties in order to craft a recommended order for Franklin County that we can provide to the county manager and the county attorney for their review. But these numbers are going up. They are significantly concerning. And this is probably the best thing that most of us can do, especially with asymptomatic transmission. So with that, I would ask, are there any questions? I've covered a lot of material.
I have a question. I heard you right there at the end, something about requiring maybe everybody to start wearing face masks. Where at, or how far along are you on that, or what are your intended recommendations and when?
Well, the when is going to be, up to, you folks. There's only so much that the health director can do. I can recommend it. I would certainly, the Board of Health does not meet again until July 14th, and I think that's too far out. This growth, if you look at the case count and not that little 2-week window snapshot they let you see, because that flattens it out. But if you look at the growth over the life of this thing, it is growing exponentially over the last 3 to 4 weeks. And that's not going to be arrested by doing what we're doing right now. And so this is the best thing I can recommend. I would recommend it. I'm going to come up and I will give you what other counties have used, the 2 counties that I mentioned, and that will be up to the county manager. and the chair to make a decision on what they want to do that. But it's my strong recommendation that we seriously consider that, given the large increase that we have not seen in the history of this virus to date.
I have one question after that. Is on the, you say Orange and Durham County. Is there any kind of statistic showing if that's done any good, or they way below the state average because of that, or anything to support the goodness of it?
It's still too early to show you concretely because of the 2-week incubation period. So as the state is quick to point out, any change that we make today, we're not going to see the results of until 2 weeks down the road. That's kind of the incubation period. So we would anticipate that with more people wearing masks, we would either see a slight decrease or a leveling off, or that the percentage of our increase would be lower than the percentage of the overall state increase. And that's another way of looking at it.
But you don't know that yet.
Yep.
But you don't know that yet.
Not yet, no.
Oh,
But
okay.
I
All
do
right.
know, and it is a fact, that when people wear a face covering, and it doesn't have to be a mask, any face covering, a bandana, a scarf, a t-shirt over the nose and mouth, if I'm wearing one and I'm asymptomatic, the likelihood of me transmitting a virus through my face covering to somebody else's face who is also covered is the lowest that it can possibly be. And when you factor in a 6-foot distance on top of that, the odds of transmitting that virus are greatly reduced. And that is scientific fact. Now, how people apply that and how many people do it, that's the rub. And you know, you look out there and I've seen it. I know you have probably seen it. The number of people that are wearing masks in public has precipitously decreased since we moved to phase 2. And you know, it's correlative. I can't say that that's what caused it, but it's certainly correlative. So, you know, putting this out there, having 2 people 6 feet apart, both wearing masks, is the safest possible way you can be out in public, given the nature this virus is transmitted. So that much I do know.
Question.
Yep.
I'm a numbers guy, so when you say it greatly reduces, is that a 30%? Is it a 80%? Put some numbers with what you just shared with us, if possible.
I don't have them with me. I can certainly get those. Absolutely. You know, there is no question that the barrier that a cloth provides for those water droplets greatly impedes them being sprayed out during a sneeze or normal conversations.
Right.
And then if I'm inhaling through another barrier and I'm practicing good hygiene, like taking it off by the straps rather than the face, not like that, and I'm washing my hands and using my hand sanitizer regularly, those things together are known to greatly reduce the transmission. So I will get you numbers for sure, but there's no question, just if you look at the way the virus gets transmitted, there is no question that 2 people wearing face coverings 6 feet apart have a less likelihood of transmitting active virus than 1 person with a mask and the other one without, or both people clearly without masks and too close together. So it's farther apart, 6 feet, and both wearing a face covering. And I'll get you the numbers.
Yeah, I think it would just, as I communicate that, having those numbers, it becomes a lot bigger than just our words, so.
Absolutely.
Question?
Yes, sir.
Yeah, my question, Scott, if you're gonna recommend that everybody in the county wear masks, and Franklin County being so diverse, will you have a recommendation about how everybody will get a mask in terms of, are we gonna be able to pass them out to folks that can't afford to get one, or what's the process there?
Well, I'm going to be really clear that it doesn't necessarily have to be a mask. And, you know, that's, I think, the important part. It can be a bandana, a scarf. In some cases, we've had people show up here and they wanted to come in and they pulled their t-shirt up over their nose.
Right.
That is sufficient. It is a sneeze barrier. It's a layer between, and that's sufficient. It doesn't have to be an N95 mask. It doesn't need to be like one of these, a surgical mask. It can be as simple as a bandana. Most people have bandanas or scarves or something around the house that they could use, a piece of cloth that they could wrap around just to cover up. And so, you know, given that, and I'm going to be clear, it's a face covering, not a mask requirement. And I'll be very clear in the wording on that for sure.
Any other questions?
Wait a minute.
Go ahead.
Yeah, I got one more. Now, I know the health director said this was like up to you all on this, the mask or the covering over your nose. And he used that you all. I know it didn't work that way with the curfew. And I'm just reaching out, I guess, Mr. Chairman, if you decide on this, if you could please share it with all the board members so we don't get caught off guard and beat up by constituents and of the change in the policy in this county. I just ask you for your consideration on that, if and when you do that.
And I can tell you that I actually did mention this in the my report to the Emergency Operations Center, of which the towns are members. I emailed them out this report where I was indicated that we were going to be making a recommendation like this. The towns regularly participate in our weekly meeting of the Emergency Operations Center. And so, you know, they will definitely not be caught surprised by this. We are going to keep them informed in terms of our part. And then when it becomes time for an order to go into place, they won't be caught flat-footed because we will be getting them this information. We've already started it.
Well, that brings a great point up though. So Scott, if you're going to share that with the towns, then it would be wonderful to share it with us.
Absolutely.
Because the towns may start to have that conversation, and then our constituents that live in the towns are going to start coming to us and we don't know anything.
Right. That just got shared with them last week at the Friday meeting. So, and I can certainly email you this report, which has all this information, a little bit more than I actually covered as well. And this is actually the EOC report. So they are aware of it, and I will definitely make sure I get that to you. And I can include you on the EOC reports that we do. On the agenda that we cover, I include the towns on that. I can certainly make sure you guys and you folks are made aware of what's going on in the EOC for sure.
Yeah, I would appreciate that very much. Yeah.
Thank you.
Yeah, okay, thank you very much, Scott. We appreciate that. And let me make several things clear here. Is that let me let you know where I am. Okay, on this position. The decision that was made before as related to the curfew was an emergency situation that I've been given authority to make, and that's exactly what I did. And I'll do that again. I will notify you if I do that. And the towns, of course, they make their own decisions as it relates to this. But the fact of the matter is that COVID-19 is a deadly virus that indeed that we're in the midst of. And there's no vaccine for it, and it's been proven, whether it's by a specific number or not, but it's been proven that right now we're at 114,000 people in this country that's deceased as a result of this. And the only weapon that we have against it is a mask, a face covering, social distancing, and washing your hands. That's just a matter of fact. And so we'll make decisions on that, but you will be notified of that.
I would like to add one thing to that, Mr. Chairman, and that is that back in 2008, I believe it was, when the H1N1 virus came out, the swine flu, I believe they called it, this nation experienced about 127,000 deaths, and there wasn't anything done. So that was dangerous as well. So I'm glad that we're taking, I'm sorry, I wasn't done. I'm glad we're taking some steps to try and preserve, which is great. Hopefully we learn from that we should do more in the beginning instead of sitting back and waiting.
Absolutely.
Thank you.
Thank you. All right. Thank you, Mr. Levine. Thank you for the great job that you're doing.
Thank you very much for your time.
Yes, sir. Item 5 on our agenda is the landscaping services contract. Assistant Manager Kim Denton, I believe, is going to be here for that presentation.
Yes. Thank you, Commissioners, for the opportunity to talk with you tonight. Chris Jones is also going to be joining us. So let's see. Coy, is Chris here?
There he is.
All right, wonderful. Again, thank you, Commissioners, for the opportunity to talk about this important topic. Chris is our facilities maintenance director, and he's going to give you some specific details about our landscaping services contract. But I just wanted to comment about how important this contract is to the ability to maintain our facilities, neatness, cleanliness, the overall appearance of Franklin County's facilities makes a great impression on those who visit and use our facilities. And so again, Chris is going to give you the details, but I really appreciate your consideration. And of course, we're both here to answer any questions that you might have. And Chris, go right ahead.
Ready to go. There he is.
Chris, I don't think, yeah, we can't hear you yet.
Unmute yourself, Chris. Unmute yourself.
Can you hear me now? Can you hear me now?
Yes, sir.
Okay. Sorry about that. As Assistant County Manager said, I'd like to give you info about the request for proposals for landscaping services for Franklin County that we put out for on May 12th. The current contract began on August 1st, 2017 and will expire July 31st, 2020. We started working on landscaping requests for proposal spec sheet early this year. The services in the RFP spec sheet included grass cutting, trimming, spraying, edging, mulching, leaf removal, overseeding, aerating, fertilizing, tree trimming, shrub and flower maintenance for 42 sites across the county. The request asked for a 3-year contract starting August 1st, 2020 and ending July 31st, 2023. The spec sheet was finalized for the RFP on May 11th and was posted in the bid opportunity section of the county website on May 12th. An ad was run in the Franklin Times on May 14th and May 21st with a link to the county bid opportunities page for proposal specs. And the request for proposals was closed on May 27th at 2 p.m. At that point, we had received 2 proposals, with Lewisburg alone being the most responsive proposal. Their price to provide the request services was $96,200 annually, to be invoiced once per month at $8,016. And I'm asking to move forward with the Lewisburg loan proposals by having the board approve and sign the contract so it'll be effective August 1st, 2020. And this was budgeted in the 2020-2021 budget.
Mr. Chairman, I make the motion that we authorize the county manager to move forward with signing this contract.
Second.
Yeah, I have a question.
Yes, sir.
Yeah, a question. What was the name of the other party that bidded? I never could find that one.
Mr. Landscape.
Mr. Landscape?
Yes, sir.
What was his bid? What was his bid amount?
It was $118,506 per year. And that would be $22,306 a year difference. With a 3-year difference, $67,000.
You know, I mean, I can see the difference. I just didn't have it. I could never find that in my packet. And I looked through all the pages, but
yes,
anyway,
sir.
all right, thank you.
Mr. Chairman,
What's that?
Mr. Chairman, you're on mute.
You're muted.
Mr. Bunn, did you second the motion?
I did.
All right. Are there any other questions? Never heard no other questions. We will do a roll call. Mr. Speed?
Yes.
Mr. Bunn?
Yes.
Madam Vice Chair?
Yes.
Mr. Jones?
yes.
Mr. Shriver?
Yes.
Mr. Ford?
Yes.
Yes. Yeses have it, and it is so ordered. Thank you so much, Kim and Chris. Thank you.
Thank you.
All right. Item 6 on the agenda is appointments. DSS Board, the board is asked to consider appointing Joyce Green McLeod for the term July 1, 2020, ending June 30th, 2023.
Move for approval.
Moved
Second.
by Mr. Speed, second by Mr. Shriver. We'll do a roll call. Any questions about that? All right, Madam Vice Chair,
Yes.
Mr. Dunn,
Yes.
Mr. Ford,
Yes.
Mr. Shriver,
Yes.
Mr. Jones,
Yes.
Mr. Speed.
Yes.
Yes, the yeses have it, and it is so ordered. The Aging Committee, Council of Government, the board is asked to consider appointing Patsy Douglas, Donnell Adams, and Dot Robinson.
Move for approval.
Mr.
Second.
Mr. Jones made the motion, Mr. Shriver second. Any questions? All right, Mr. Speed,
Yes.
Mrs. Dickerson,
Yes.
Mr. Bunn,
Yes.
Mr. Foy,
Yes.
Mr. Shriver,
Yes.
Mr. Jones.
Yes.
Yes, the yeses have it, and it is so ordered. Item 7 on the agenda is other business. Any other business?
No, sir.
No other business to come before us. Item 8 is board manager and clerk's comments. This is time set aside for the board, county managers, county commissioners, county manager, and the clerk of the board to report on various activities. All right, Mr. Bunn.
I have no comment.
Mr. Foy,
I have no comment.
Mr. Shriver,
No comments.
Mr. Jones,
No comment.
Mr. Speed,
No comment.
Madam Dickerson, Madam Vice
No.
Chair.
No comment.
All right. Madam Manager,
No comment.
no comment. All right, I have no comment. We'll move to item number 9. Closed session. The board is asked to conduct a closed session pursuant to North Carolina General Statute 143-318.11A3, attorney-client privilege communications. What is the pleasure of the board?
Move to approve.
Mr.
Second.
Shriver move to approve. Mr. Speed, second. Any questions? No questions. Mr. Bunn.
Yes.
Madam Vice Chair Dickerson.
Yes.
Mr. Ford.
No.
Mr. Shriver.
Yes.
Mr. Jones.
Yes.
Yes, yeses have it, and it is so ordered. All right, we'll see you in closed session. Thank you. Okay. All right. All right, I will entertain a motion to go back into open session.
So moved.
Moved by Mr. Bunn, is that right? Is that
Mr. Speed,
Oh, Mr. Speed, I'm sorry.
but I will second it.
All right, Mr. Bunn, second. Mr. Shriver?
Motion to adjourn, sir.
Okay. Second?
Second.
All right, Mr. Bunn, second. Mr. Speed, what's your vote? Mr.
Yes.
Speed? Mr. Jones?
Yes.
Ms. Dickerson?
Yes.
Mr. Shriver?
Yes.
Mr. Foy? Mr. Bunn?
Yes.
All right. Yeses have it, and it's so ordered. Good night.
Good night.
Right.
Thank you, Mr. Thomas.
Good night.